second link of a term called out of the hospital chain of survival, which describes the emergency cardiovascular care, or the ECC. CPR is also known as cardiopulmonary resuscitation. It is an emergency technique that can increase the chances of survival if done immediately after cardiac arrest, heart attack, or near drowning in which someone's breathing or heartbeat has stopped. CPR can be done for everyone, and it has been proven that the middle school level children can do this with training. Men are more likely to receive CPR due to whether someone is comfortable touching a woman's chest. Know that this is of no importance when the situation is life or death. So imagine, you have a friend, and that friend meets up with you. That friend is now on the ground, and you happen to notice this. Here is what you should do. You should first check the environment. Look for anything that could be in danger to you or others. Watch out for smoke, electricity, fire, oncoming traffic, or blood, which may carry disease. If you happen to see any of this, stay away and call 911. You should then check for consciousness. Try to shake and yell at the collapsed person and check if there's any response. Third, you should check for breathing. Listen for breathing and try to feel their breath on your cheek. Check for a pulse. If you can, gasping does not count as breathing. Do this for only 10 seconds. You should lastly call 911 if they're neither breathing nor responding. For CPR for you, you should make sure that the person is lying down on their back on a flat, solid surface. Kneel next to the person's neck and shoulder. Your hands will be very important here, especially to the palms of your hands. Locate the center of your chest and between the nipples. Place one hand on the lower palm in the center of the chest. Place your hand on the top of the first and clench it. Keep your elbows straight and directly above your hands. Push straight down on the chest for at least 2 inches or 5 centimeters, but no more than 2.4 inches or 6 centimeters. Push hard and fast at a rate of 100 to 120 compressions a minute. You can do this to the beat of the song Staying Alive to do this. Now stay if this is an adult, is now a child. You will repeat the stages 1 through 4. Check for the environment, watch for smoke, electricity, fire, oncoming traffic, and blood. Check for consciousness, check for breathing, and call 911. You can use 2 hands for older and bigger children, but for younger and smaller children, you should use 1 hand. For 1 CPR, you should place on the hand of the head of the child and place the hands on the palm of the lower half of the child's breastbone. Press straight down for about 2 inches, but no more than 2.4 inches. Push hard and fast for 100 to 120 compressions a minute. Now let's say this child turns into a baby. You would first evaluate the situation by checking for breathingness and consciousness. You would first touch them and watch for a response. Instead of shaking the baby gently, tap its shoulder or flick its foot. A baby has a periodic breathing system. Check if the baby is pale, purple, or have blue skin. Check how its chest moves. If the baby does not breathe for more than a few seconds, you will check the safety of the environment and call 911. Place the baby on a firm, flat surface. Imagine horizontal lines drawn between the baby's nipples. Place 2 fingers on the center of the chest just below the line. Do not compress hard. Compress the chest gently about 1.5 inches or about 4 centimeters. Count aloud as you push at the rate of 100 to 120 compressions a minute. Whether it's CPR for an adult, a child, or a baby, you should stop for this action. If the collapsed person starts breathing again, if they show signs of consciousness such as movement, if you are exhausted, or until medical help arrives, they can take over. Find out more on CPR and on training on these websites. Thank you for listening.